Hi, everyone. Thank you so much for joining us for tonight's program, A Circle of Conversation hosted by Jane Doe Inc. This evening, we're going to be talking about reproductive justice. It's a healthcare right for all, and its specific meaning for people who experience sexual and domestic violence. We're delighted to have Sara Stanley, board member, hosting the conversation, and our guests from the ACLU, Carol Rose, and Partners in Sex Education, Sukriti Debra. We had a little technical glitch, so we missed the first minute or two of the opening remarks. So we're going to be jumping in to the middle of the welcome from Debra Robbin, JDI's Executive Director. Thanks so much for your interest. Hope you enjoy hearing about the Healthy Youth Act, the Roe Act, and why these issues are so critical to our work as anti-violence advocates. If you have any questions, let us know. Enjoy. Thanks for your support.
And it'll be the 7th week. We have close to 50 organizations every Friday afternoon who show up to talk about what's happening in their programs. We've had guests, we've had other folks joining us, and it has been a really amazing, and some of you also have been on those. We're also doing other convenings of advocates. We've done a lot of work around trauma, and we're also expanding our webinar offerings April through June to help folks really think about what does it mean to run an organization in a virtual space? What does it mean to do supervision in a trauma-informed way in a virtual space? And so we're thinking creatively about what the needs are, both in the field, with our members, and with many of our partners. So that's really amazing. And the thing I also want to say about Jane Doe, as many of you probably know already, but it is always important to mention that we do our work at the intersections of gender-based violence and racial justice and equity. And so we always, in our programming, in our messaging, in our communications, in our policy work, think about those intersections and try to ask a lot of questions before we endorse something, before we put something on, to really think about what is the broader social justice message that we're presenting. And I think that we've had many collective conversations about this pandemic, and that it is not necessarily showing us anything new, but that it is more elevating and demonstrating all the cracks that we know that they already exist, and that the racial and class disparities and the impacts disproportionately on communities of color is something we're very mindful of. We're very much talking about. We've partnered with the Mass Public Health Association and signed on to their equity agenda, and is something we're thinking a lot about in terms of survivors whose needs, are varied and intense and very layered, and how we will all step up to the plate and think about that. So I think that's a really good foundation for us for the conversation that we're going to have today. And really, I'm so honored that Carol Rose and, where'd you go, Sukriti? There you are on my screen, are working with us today to have this conversation. It's a really important time because we also know that reproductive justice is part of our work in this space to talk about these intersections, and particularly right now, when it has felt for quite a long time and feels even more so now that so many things that we might have taken for granted are under attack and may not continue to exist in the way that they have. And it can be both scary and hard to deal with, and it also inspires our activist selves. And so I call on all of us to dig deep inside that place where you might be like, oh, I don't know if I can do this, but really we can. And I've been heartened, by a lot of the generosity of folks just in the broader communities. And I think we are seeing that in many places. We're also seeing that nothing will happen without a fight. And we're all ready for that collectively because we get our strength from each other. I'm also really thrilled that Sara Stanley, who's the executive director of Hawk and a Jane Doe board member and really engaged with this work, is going to be facilitating the conversation this afternoon. And I'm thrilled to welcome all of you for taking a little time out of your day or late afternoon, early evening, and joining us for this. And I'm happy to see so many familiar faces and so many unfamiliar faces. And if we were in a physical place together, as we thought we would, I always try and say hello to every single person at any event that we have. I think you all know that. And so I'm sorry I can't do that definitely in person today. I know that we will be together again in that kind of a space, but thrilled to welcome you. And just any questions, comments, feedback, you can always reach us at Jane Doe or through the chat function of this of Zoom. And I'm going to hand it over to Sara now.
Great, thank you, Debra. I'm really very honored to be with you all today. Can I see a quick show of hands? Who is attending their first Jane Doe event or having their first interaction with Jane Doe today? A couple. Okay, great. Well, I will share. My name is Sara Stanley. My pronouns are she, her, and hers. I'm the executive director of Hawk, Healing Abuse, Working for Change, a domestic violence agency on the North Shore. And I'm very proud to be a Jane Doe board member. And I actually first learned about Jane Doe at a Jane Doe house party, much like some of you getting to know Jane Doe for the first time today. And I was immediately impressed by Debra's passion as a leader. But then every day since then, I've been so appreciative of Jane Doe's intersectional, comprehensive, multidisciplinary, and collaborative approach to this work. And I think as you learn more about Jane Doe, you will become as appreciative as I am. As the executive director of a member program, I'm the beneficiary of Jane Doe's leadership, and in so many ways, but I want to really stress the leadership that JDI is taking today in the midst of the COVID-19 pandemic. We really would be struggling without JDI's leadership, and for those of you who already support Jane Doe and those of you looking to make an impact in this field, by supporting Jane Doe, you are really making a real difference in real time. So thank you, JDI, and thank you to all the JDI supporters with us today. I'm here today on behalf of the Jane Doe board to facilitate this discussion on reproductive justice. And JDI decided to raise up this conversation not as a tangential hot topic, but as a critical component of what we're fighting for: gender equity, racial equity, and safety for all. We know that reproductive justice acknowledges someone's right to bodily autonomy, and it's realized through the basic human right of access to health care. Laws that inhibit our bodily integrity are part of the larger nefarious attack and social norms on individuals' humanity. And the result is treating some people as less than. And as our speakers, Sukriti and Carol, will speak to over the course of today's conversation, one's age, gender identity, sexual orientation, economic status are often too often factors that limit someone's access to reproductive health care. While Massachusetts has been a leader in so many ways, we know that there's still work to do. And today we will talk about the Healthy Youth Act as well as the Roe Act. And I will share that in my experience working at Hawk, we see someone's access to reproductive health care often leveraged as a tactic, a tool by an abusive person. For example, if someone does not have access to birth control, their abusive partner will take advantage of that and then use financial control to limit that person's ability to leave the relationship. Likewise, when someone experiences a non-partner sexual assault, if that person is unable to access whether it's abortion or other reproductive health care, it has long-term effects, not only physical, emotional, and economic. We're so honored to have with us today Sukriti Dobral, who is a sexuality educator at Partners in Sex Education, and Carol Rose, the executive director of the ACLU in Massachusetts. So now I'm going to hand it over to Sukriti to share with us why is sexuality education a priority right now?
Hi, everybody. Thank you so much, Sarah and Deborah and Tony for having me. It's an honor to be asked to do something like this. I met a few Jane Doe staff members at a advocacy day at the State House for the Healthy Youth Act earlier this year. And if you can't see from far away, that's what this button says. It says, I support the Healthy Youth Act. And I use they and she pronouns. And I work for an organization called Partners in Sex Education, which is a really tiny little operation, but we teach sex ed programming in independent charter private schools in the greater Boston area. And why sex education is so important and why it so nicely fits in with Jane Doe's mission is that we know that sex education is in fact violence prevention work, and that it is in fact reproductive justice education, and is reproductive justice in and of itself to do sex education, to have young people especially have access to medically accurate, age appropriate, LGBT inclusive, and consent focused education. Those are the four main components of the Healthy Youth Act that says that every student in Massachusetts should have access to health education that is inclusive of sex education in those many ways. We know that marginalized communities, racially and gender-wise and otherwise, definitely have the highest rates of health-related complications and negative outcomes. And so sex education is, of course, like it's preventative work that's really essential. And I'm really glad to be able to share this like virtual space and advocating for the Healthy Youth Act, and hopefully through my experience as an educator be able to answer questions or contribute. And I don't know, I'm excited to see how it's going to turn out, what kinds of questions people have to clarify why this kind of legislation is so important, and hopefully get people activated also to reach out to their congresspeople, because adults often really overlook how important it is for young people to have access to information. And there's a lot of fear and a lot of stigma around sex ed historically that has to do with, you know, whether teaching about sexuality and about sex and relationships is actually useful for young people. Is it going to make them do things sooner than they quote unquote should? Is it going to push certain values? And you know, quality sex education doesn't push values. It just teaches information and facts and gives access. And again, as somebody who works in independent and private and charter schools, I really do see the equity issue that is happening in this field, because I don't go into public schools, right? There isn't the same standard being held in all the different districts in Massachusetts. While Boston Public Schools does an amazing job, in fact, our director, Meg Bell at Partners in Sex Ed, is also in charge of running the show over at BPS for Sex Ed, and they're actually here in this meeting as well. I'm happy to see. Yeah, so we see it as an equity issue to push legislation that actually would give the kind of quality sex ed that we're able to provide in the private schools and independent schools, to get that everywhere in Massachusetts. And to clarify also, the Act does not mandate sex ed. It just says that if a school district chooses to teach sex ed, that it should meet certain state standards for that sex ed that are across the board applicable. Because at the moment, people like me and Megra and others who are doing sex ed, we really are only held to our own standards when it comes to the work that we're doing. So yeah, thank you so much again for having me. I look forward to the conversation, and I'll pass it along to Carol Rose, which is so weird to say that I'm in the same speaker panel as her.
Oh my God, Sukriti, I was going to say that about you. So it's great to be here. Thank you. So I am Carol Rose. I use she, her pronouns, and I'm the executive director at the ACLU here in Massachusetts. And for those who don't know the ACLU, a lot of people know the name, but don't always know how we operate. So we are, there's an ACLU in all 50 states, an office, and we're a membership organization, so we don't take government money. And we work in the courts, and we work in the legislature, and we work online and in the streets, and we do a lot of coalition work. Our issues are also we include reproductive rights, racial justice, immigrants' rights, gender equality, LGBTQ, privacy. So the range of issues. And because we're an intersectional organization, Jane Doe, especially under Debra Robbin's leadership, has been so instrumental to us and such an important ally, because we're all about movement building and doing this work together, and working with Jane Doe and with Debra has really been, I've learned so much from her. She's a great ally. The organization is a great ally. And this is really about movement building, because any one of our single issue approaches or organizations isn't strong enough to take on the threats that we face and the change we need to see in this society. So when we have movement building and we work together, shoulder to shoulder, we all get stronger. And when we get stronger, we win every now and then. So I'm really proud to be here. I'm honored to be here. And I'm really honored to meet all of you, and anybody who likes Jane Doe and the work of Debra Robbins is a friend of mine. Just want to say that. I also mentioned I started the Debra Robbins fan club. That's my other job.
Right now I'm blushing.
You should be. So there's a lot of stuff, and I want to save time for the question and answer period, but I wanted to just talk briefly about some of the reproductive justice landscape that's happening, and how it relates to these fundamental issues of access and control over our bodies and control over our lives, which is so much about what JDI is about. So nationwide, after the coronavirus outbreak, a lot of the issue came down to whether or not access to reproductive health care was considered time urgent, an emergency, essential service. And as you can, of course, because pregnancy is time bound and access to reproductive justice is time bound, it's important that people have access to be able to get to an abortion clinic. We are lucky here in Massachusetts. Governor Charlie Baker actually did say that it's considered an essential service, but in a lot of other places, especially in the South, there was a lot of governors didn't do that. So the ACLU a couple weeks ago filed a lawsuit to challenge in Arkansas an effort to try to deny access. The other big case that you'll just can pay attention to, it's going to come out any day, either on Monday or Thursday, I think. The Supreme Court, U.S. Supreme Court is hearing a case out of Louisiana trying to say, put restrictions to say that people can't get access to abortion unless a doctor has admitting privileges at a nearby hospital within 30 miles. That makes no logical sense from a medical perspective to do that, so it's really just an anti-abortion move. And so there's a challenge to that in the U.S. Supreme Court, and we'll see how that comes down probably in the next few days. So stay tuned for that. It's going to be really interesting, and it'll tell us a lot about the new court with Brett Kavanaugh on the bench. At the state level, I want to talk a little bit about what's going on in the state legislature. So last session, working with JDI, we passed the PATCH Act, which ensures confidentiality on healthcare information. And you can imagine how important this is for youth who are on their parents' healthcare systems and maybe want to access contraception or abortion access. They might not want their parents to know about it. People who are survivors of domestic violence and have counseling records may not want their partners to see those records. So again, privacy, I really think of privacy as almost synonymous with control over our bodies, with autonomy. And so ensuring that kind of privacy was a really important bill that we passed with the PATCH Act. And again, Jane Doe was a huge leader on that, and the ACLU was a huge supporter of Jane Doe on that. But you guys led the way, and I think that was great. The bill that's currently pending in the state legislature, and it's due out on May 12th, is called the Roe Act. And this is, again, a coalition effort that includes ACLU. I think Jane Doe's there, NARAL, Planned Parenthood, you name it. There's a big group of organizations. And the Roe Act has two aspects to it, again, which are both intersectional and who gets affected by it, right? So what the Roe Act would say is, here in Massachusetts, if someone is a minor, is under the age of 18, and for whatever reason they can't get parental consent, and you can imagine what the reasons might be that somebody couldn't get parental consent, right? Kids in foster care, kids who are victims of incest or other kinds of things, they can't go to the parent to get permission. Well, currently they have to go to a judge. Now you can imagine how crazy that is. Like, how does a youth with limited time before they can access abortion care needs to find a judge and may be afraid of a judge, and not to mention the fact judges aren't trained to spot if someone has been a victim of violence or abuse versus a doctor. So what the Roe Act would say is, rather than having minors go to a judge if they can't get parental consent, they should go to a doctor because it's healthcare. So it's a really common sense, logical thing. So you see a lot of people who are opposed to this trying to make it, kids are going to be unfettered access to abortion. No, it's really about saying they should go to a doctor instead of a judge. So it's about protecting our youth. And then the second is really, I call it the anti-cruelty provision. Right now in Massachusetts, after 24 weeks, if a person is carrying a fetus, a baby, and they find out, and this is often a wanted child, and they find out that the fetus has a fatal fetal anomaly, that the fetus can't live outside the womb. The notion that they would have to carry that to term, endangering the health and welfare of the mother, is so cruel. If there's no chance for it to survive, why shouldn't you be able to go to your doctor and decide to get an abortion? Instead, right now, they have to fly to Colorado or some other place far away from their doctors, only if they have enough money. It's expensive to do that, far away from their families, in order to get this abortion later in term when there's a fatal fetal anomaly. And you can imagine, again, this coronavirus has really taken all of the injustices that existed before and just brought them into stark relief. So now, how could you fly to Colorado? You would really be endangering your health to do that. And so we think the passage of the Roe Act actually has become more important in light of the coronavirus. And so we're continuing to work on that. Right now, the state legislature is not in formal session, so this isn't probably the time to do that. So we're pushing to actually buy more time beyond when the committee report is on May 12th to maybe see if they can postpone that. So when the legislature comes back into session in June or July, that they can take up the Roe Act and hopefully pass it. So there's lots more we could be talking about, but I'd really like to hear from all of you. Thanks.
All right, great. Thank you both. I'm really interested in something you mentioned, Carol, about movement building, because we know when we're thinking about these issues and it feels like, God, didn't we win this fight a while ago? And things are rolling back, and for and so, you know, we're like, okay, how do we get momentum? How are we going to build this movement up? And I'm really curious to hear more about the coalitions that are being formed across different communities to try and get these pieces of legislation passed.
Yeah, no, it's a great question. You know, I really think that I'm a big believer in agency. I think we can make a difference, each one of us taking action. Just, it's like butterflies, you know, the wings flap and things happen. I really think that when we work together, when we form movement building, we're up against often powerful forces of prejudice and misogyny and just status quoism, all these things that are there and people in power. But when we come together and we stand shoulder to shoulder, we are stronger. There is strength in numbers, right? And I think whether we're dealing with issues of reproductive choice and access, whether we're dealing with domestic violence, when we're dealing with racism, you know, transphobia, all of these things, they really work in concert. And people who are like-minded around issues, around principles of justice and fairness and equity, those apply across the board. And I really think there's an interesting moment now with public health. We've been saying at the ACLU for a very long time that we can't necessarily criminalize our way out of a lot of the ills that are out there. And all of a sudden with this coronavirus, we have seen how when we are faced with a massive public health crisis, a pandemic, we can change. As a society, we can change. We can all decide to self-quarantine and help the people who can't do it easily get access to resources so they can too. I mean, it's not that easy for everybody to do it. And that's, we're looking at equity issues. How can we get more space, hotel rooms, et cetera. But as a society, we can make great changes quite quickly. But what about the pandemic of domestic violence? What about the pandemic of racism, the pandemic of poverty, the pandemic of substance use disorder? These two are pandemics. And maybe what we really need to think about is using the lessons of the COVID-19 crisis to begin to think about movement building and public health community responses to these ills by reframing them, not as something we can criminal arrest our way out of necessarily, but what we really can do is to have public health responses whereby what is good for other people is also good for me. And that's, I think, the essence of movement building.
Kriti, I'm wondering, what do you think it will take to get to solidify public support behind the Healthy Youth Act?
Yeah, so, you know, in reality, there's a lot of public support already. The majority of people in Massachusetts already support, of likely voters already support the idea of having sex ed in schools. And the trouble, I think, really comes down to moving our legislators, getting them to actually do something about it, because historically sexuality related bills just don't move very much. They're kind of risky. And so when legislators are sort of like, oh, this is a touchy topic, you know, I'd rather not mess with my long uncontested seat, right? And sort of make this an issue, they just don't do anything. And that's where we come in. And I think it's really important that, yeah, I think it's been over a decade that some version of this bill has been we've been trying to pass. And so, you know, it does feel like a bit of a slog. And I haven't even been around for that whole decade doing this, but it's like clear to me that it's really important that constituents actually push, right? So what I think will cause the change is just more engagement by actual citizens who already agree and believe in the work of, you know, what is written out in the Healthy Youth Act as far as what people deserve to have in high schools. So yeah, that's what I think is the main thing, is just action and really putting pressure on.
I should unmute myself. Carol, if you could talk in a little bit more detail about, you know, if folks are saying, yes, you know, you're on this call, you're like, yes, you know, I want to see the Roe Act pass. What should they be looking for action steps right now?
Great, yeah. So, I mean, the number one, be a part of, you know, Jane Doe and Hawk and the ACLU, like get yourself engaged on a platform so you can be up to speed about when to take what actions, because we have action steps that go out all the time. Take those actions, the email and the phone actions. It is amazing how much difference. So the Massachusetts legislature, sort of, Congress is big and huge and federal, and it's hard to get through. But the Massachusetts legislature, you know, if the legislator gets 5 calls, they're like, whoa, you know, my people want this. So it makes a difference. Your call makes a difference. Your email makes a difference. You know, find out who your elected state senator or rep is. It's easy. You can, anytime you take an action, they'll ask you what your zip code is, and they can tell you, and it automatically generates who your state rep is. But, you know, tell them, have a relationship. They work for you. They work for us, right? And they don't hear from us that often, shockingly. So, you know, make sure, raise your voice, because it does make a difference. And I think that we can't fix everything in the world all at once, but we have a lot more power than we think. And if we exercise it, I always think of, you know, political, it's like a muscle. Democracy is like a muscle. The more you use it, the stronger it gets. And I think we need to flex our muscles individually and collectively. And when we do it in alignment with other organizations, in coalition, but as individuals working in coalition, all of a sudden we are a lot stronger or more muscular than we are just as an individual, you know, sitting in our little houses that we are, like we are today. But together, we actually can change the world. I don't mean to sound overly Pollyanna about it, but I actually have seen it work. That's how we got things like equal marriage, because enough of us, just enough people, gay, straight, and bi, everybody came together and just said, we want this change. This is common sense change. The principle of fairness and equity demand this. So when the Speaker of the House, Bob DeLeo, and the Senate President, Karen Spilka, have enough of their people calling saying, my constituents really care about Healthy Youth Act. My constituents really care about the Roe Act. I'm getting lots of calls about that. They listen. So that's what we wanted to change the political landscape, to make it politically in their interest to do the right thing.
I'll also add, and I know some of you have participated in the Jane Doe Advocacy Day alongside me, our state reps and senators love hearing the story that you have as to why you think this legislation is important, why you think certain funding is important. And so any contact that you can have with them to share why it's important to you, then put a personal spin on this legislation that is really powerful and is a way for them to then advocate for it in turn with the other folks at the table. So I really encourage everyone to share their stories. So we've talked a little bit about gender equity and racial justice, but I was hoping that both of you could talk a little bit about the role they play in preventing gender-based violence. May I pass it to you, Sukriti?
Sure. Yeah, gender-based violence is really rooted in concepts that we learn about what gender means, right? And about what it means to be successful at our genders. And particularly for men, a question I love asking students is like, what does it mean to you to be a man? What does it mean? And how do you feel affirmed? When is it that you feel most affirmed in your manness or manhood? Or for girls, when do you feel most affirmed in the fact that you're a girl? And for non-binary kids and trans kids, you know, the same question applies about their gender identities. And I really don't know how else to put it other than like gender-based violence comes from a sense of unworthiness or a sense of, you know, not good enoughness around very often masculinity and needing to perform masculinity in order to find some sense of that assurance of identity of self. And it's really unfortunate that that is the way that patriarchy and that our culture historically has sort of trained us. And I say us because it's people of all genders that are trained into that way of thinking, and people of all genders perpetuate those kinds of ideologies. And it's like, it's like once you start seeing through the lens more clearly, it feels really obvious, and it feels kind of like, well, why don't we have a different way? Why don't we have other options for how people get to be themselves well in the world? You know, why are we sticking in these boxes that we were given about what it means to be a certain gender? And obviously, I'm Indian. My parents immigrated from India in the 80s, and I come from a culture that is among many cultures that in which like there's a certain machismo, there's a certain sort of like, to borrow from the Latinx community, there's a certain, you know, sense of rigidity around how you're supposed to be and what you're supposed to do. And so I just think it's so important for all people of all ages, but especially with the opportunity to access educational spaces with young people, to help them and all of us to question some of these things that we assume about the way things should be or the way things are, and really vision more about how the world could look. And the thing about violence is I wholeheartedly believe that nobody actually enjoys violence, not the perpetrator, not the victim. And that is not to somehow remove accountability from people who perpetrate violence. It's just to zoom out and look at broader, more root, I should say, causes of that violence. And so, yeah, I think that, again, sex education is like a really essential way of starting to at least start those conversations for people. We also know that primarily the values and ideas around sexuality and relationships and gender that we learn come from our families or come from the people that raised us. And so, you know, ultimately it's a larger scale cultural shift that has to happen, of course, but I am excited that like Massachusetts is a place that really values or is trying to value sex education as a way to get that conversation going. And to reduce gender-based violence and actually all kinds of violence, I think, as a result.
I mean, Sukriti's got it. That's so great. It really comes down to fundamental, you know, radical, look at something by the roots, radical change. And that starts with our youth, that starts with education, just fundamentally. And that's why education and democracy are closely aligned. But there also is a power analysis that comes with that on top of that, which is that a lot of times people who are disempowered by historical accident of their birth, you know, I was talking about pandemics of poverty, pandemics of racism, pandemics of mental health, substance use disorder. They arise out of a system of inequity, a racially inequity, of economic inequity. And these are deeply, deeply rooted in our nation. And so changing them seems really hard. Byron Rushing, who is a state legislature and a reverend, great person, he once gave a sermon I heard him talk about, and he said, you know, the people who wrote our Constitution were like, you know, white, presented as straight, male, property owning people, and they were talking about equality, and they did a lot of mistakes when they wrote the Constitution. So why should we care about them? And what he talked about, it was in the context actually of equal marriage, but it applies in all of these contexts of racism, inequality. And Byron himself is African American. And he talked about the fact that the people who heard it, the principles that were put forth of equality and justice and fairness and equity, they applied it to themselves. And they said, well, I want that. I don't care who wrote it. It's the power's in the hearing. And then women heard it and said, I want the vote too. And then, you know, LGBTQ people heard it and said, I want it too. And so a lot of the principles that we aspire to, even if we haven't realized them in this country fully, and we haven't, of equity and equality and life, liberty, and the pursuit of happiness, they don't exist for everybody. And again, like I said earlier, this virus, this pandemic, has really brought into stark relief the inequalities along race and economic lines. But we have an opportunity to take the principles that we hold to be self-evident in this country and to actually try to do something about it now. And there's no denying it. So I think there's this great public education, consciousness raising opportunity that happens every so often in this country where things do change. And it's not as fast as we need. It's not as fast as we want, but it does change. And in that change and then opportunity to exercise our political muscle together, there is hope through action. So, you know, as I look at the sort of, you know, hope, despair continuum, I wake up every day and try to choose hope. even and maybe especially at a time of despair. But it's a choice, and it's a choice that we make individually every day with what we're going to do with that day. And for me, taking political action, and especially I'm now old enough to actually see that it can make change, that gives me hope. So I don't act because I'm hopeful because I act.
When we think about the current pandemic, and we know that we are witnessing the cracks in our society that it's exposing. But what do you see as the next best step for us to move forward? And that's a big question.
Well,
what do we think?
Right. I mean, part of it is to say not good enough, not good enough. Some of the inequities that we're seeing, especially the racial inequities, if you look at the overlay of the maps, for example, just in Boston neighborhoods, we know that Black and brown people are getting COVID at a higher rate, and they're dying at a higher rate. And so there's a lot of structural inequities that are there. But what are we going to do about it? So one thing we've been pushing for on the Mayor's Task Force on Healthcare Inequalities, for example, is to try to say that who gets access to testing first? Maybe it's the people who we say have these essential jobs that have to be there, because that's really a lot of what the overlay is. Who gets access to the antibody tests? Who's going to get access, when a vaccine is developed? Who gets it first? Maybe it's not just the rich people. So we, again, have an opportunity, because we can hold this up. Nobody can deny these, and nobody can deny it. How can we change it? What affirmative steps are we going to take to change it? And this is where, so the Roe Act, for example, like, it just makes it so obvious that the notion that you would ask minors to go to a court right now, the courts are closed, except for emergency hearings, or that you would ask somebody to go to a different state to get abortion access. It's crazy. But it's crazy all the time. I mean, it just makes it even more obvious. So we have this opportunity to push through the things that we were trying in the equality legislation and the access to protect healthcare access. We have an opportunity now to push those through that we wanted to do before, but now it's even more evident, I think, to the general public. And so we have this opportunity now, but what we have to do is to keep our eye on that ball and push it through right now, not to wait and go, well, when it's over, then we'll push for it. Well, it's not, the world has changed. There's no over. It's just a new reality. Let's move forward. Let's move forward.
I would
Great point.
love to just echo and say that I wholeheartedly appreciate and support everything Carol just said. And on, the question of the new world and coming out of this and sex education, I mean, sex education is a luxury if survival is what you're focused on, right? Like, if you can't even survive, like, forget age appropriate, consent focused education, all that is like extra if basic human needs aren't taken care of first. And so really there's nothing I want to add other than that, just to emphasize that what Carol said needs to get taken care of first before we can really focus, I think, in a meaningful way on stuff like Healthy Youth Act. Yeah.
Great. Well, we'd like to take some questions now from you all. And this question is from Alyssa Wright, who is joining us tonight. She asks, are there specific leaders in our communities we should make aware of this, and how to get them behind these acts? Who do we think can help mobilize our voters? Are there business leaders or superintendents of schools? Who do we see as the playmakers that can help get these across the line that people should be reaching out to?
On the Roe Act, it's your state legislator. So it's your local state legislator. On the Healthy Youth Act, Sukriti, there might be a broader.
I mean, the first answer is the legislators, your local legislators. And then also, I think that schools are a really powerful hub, because this is about school-based education. If you're part of a PTA, or if you can advocate through the admin at your school to get them to encourage then the rest of the parents, to write the legislators, like that kind of thing, I think could be really helpful. And this is a question I don't know the answer any more than someone else might in that way, because it's really just about moving legislators. So I want to hear if anyone else has ideas too.
I think I saw Adrienne on this call. I don't know if she's still with us. Any of our Jane Doe folks want to chime in? No.
I was actually thinking, as you were talking about other movements, what are some of the lessons that we can, either lessons that, teachable moments that some of those other challenging situations brought us, or things that we should bring into this current debate? When you were mentioning equal marriage, I was thinking along parallel, maybe not similar lines, but we had to really think about the myths, and there was the hatred that some folks were spewing. I'll put that over there. But there were also a lot of myths and that we had to consistently address and correct, and not in a, and found a way to, in some instances, to do that, not in a, how we bring people in instead of calling them out for those that we might be able to make movement. And so when I think about healthy youth, which is just, there's some part of me that's like, I cannot believe we're still talking about this. And I have been around since the early days. And so I start to think about, well, why is it so threatening? Where are the way that we're even, is the way that we're even talking about this? Should we be thinking about other strategies? And I don't have an answer for that, although I did recently have an experience with an elected official who kind of a little bit on his own, and maybe because we have approached him so persistently, but he does not want to see sexual assault and domestic violence happening. And he somehow was able to connect the dots that the Healthy Youth Act is actually a form of prevention. And that, like, it was like a light went off for him. And I thought we were making that point, but I really think he sort of got there more a little bit on his own. And so, but he had to have a certain amount of openness to do that. But what are some of the strategies as we're talking with folks about this, or, even when we're talking to people who aren't elected officials, but talking to them to talk to their elected officials? It can't just be pass this bill because we need it. Like, what are some of the deeper underlying, what nerve is it touching, that we need to start to unpack?
If I might, a couple of things. I think one is humanizing things, telling stories of real people. I always talk about the real lives of real people. It's not just the numbers or, the data. You actually have to make it real. This is preventative medicine. Let me tell you the story of what happened to somebody and why it's preventive medicine. I think that's really important. I think words matter. We spend a lot of time at the ACLU thinking about how to frame what we talk about. So for example, I talked earlier about the compassionate late-term access to medical care, that it's a compassionate move to not make somebody who has a wanted child have to go to carry it to term or fly out of state, right? This just seems cruel, right? But our opponents call it infanticide. Like, that's a hard one to overcome. Yeah, who's in favor of that, right? Nobody. So we need to really think about the words that we use, how we frame things, how we talk about it. And there was an amazing conversation I had with a legislator on the Roe Act about talking about the youth protection, saying people should go to doctors instead of going to judges. And they've been talking about it as, kids getting around their parents. And he's like, I wouldn't want my daughter, to get around me. And I was like, well, I'm sure your daughter and you have a trusting and loving relationship. This is about people who don't have a trusting and loving relationship with their fathers. And I'm sure that's not you, but it's someone, and you know that. And, oh, well, if you're not talking about me, then I'm okay with it. Like, it was a very, so thinking about making it, because people act out of fear, and they act out of fear of change or fear of anything. So if I do nothing, that's always feels safer. And so getting these legislators, so I would say first is like storytelling and making it about the real lives of real people. But the other thing I've been thinking about, especially around issues of race and equity, it's really easy to, and storytelling can exacerbate this, as to otherize. Well, as long as it's not affecting me, if it's just affecting other people, I'm not going to do anything about it. I may care and tisk, but I'm not going to change. Public health shows us that when someone else is affected by this virus, I'm affected too. It's in my self-interest to address the inequities, because I don't want to die, right? And so there's a selfish gene here that comes into play. So I think to the extent that with legislators, we say, you'll be politically better off if you do the right thing. But even to bring it around and to say, if we begin to address these ills in our society, whether domestic violence or racism, inequality, as public health issues, we're raising everybody's vote, makes me better off too. I think that's how we begin to change minds. So I've been thinking, and this is a pretty unformed thought yet, so I invite all of you to offer suggestions, but to sort of change the frame toward this public health model as a way that by protecting someone else's rights, I protect my own, because we're all in this together.
Yeah, totally. I agree that thinking about things in terms of, and this is something this virus and the situation I think has really emphasized, is just the fact of our interdependence is so much more clear right now, to me at least. And really considering like, okay, now that there's this like consciousness around the fact of our interdependence being really a real thing, how can we apply that to other problems in our culture, in our society? And so yeah, I completely agree with that. And also something, Carol, you said about fear it's really resonated, that I think that one of the main things absolutely that keeps people from acting is fear and just ignorance, and fear around topics that have just historically for hundreds, you know, I don't even know, maybe more than hundreds, right, of years been stigmatized. And then as soon as you kind of put the word youth and sexuality together, everybody, you know, people have a tendency to just kind of freak out. And it's like, you know, sexuality is something that exists from before birth until death. You know, there's so many aspects of sexuality that are just part of regular life, that I think when we talk about sex ed, people sometimes there's like a PR problem, right? Like people think about like, oh, you're going to teach my kid to put condoms on bananas and like encourage them to have sex, and that's what this is about. And I think a lot of the work right now is around really helping people understand that it's way more holistic than that, right? That might be like one small activity, maybe, you know, that somebody gets to do, because having skills is not the same thing as encouraging somebody to do something with those skills. The idea that young people have zero control and have zero sort of sense of responsibility over themselves is really untrue. Like kids want to be, you know, responsible. They want to make good choices for themselves, and they really are ill-equipped. And so I think that for all of us, when we're talking to legislators and when we're trying to do the work of pushing this stuff, really talking about how it's about being a whole human, a healthy human being in a holistic way. It's not just about like, oh, when you decide to do this one activity, this is how you protect yourself from getting an STI, although that is a component of it. Consent education is such a huge part of sex education and of quality sex education. In fact, I think it's unethical to teach any kind of sex ed in the absence of consent education. And you know, the fact that we're even talking about consent education is interesting to me, because consent is a legal term, you know, and really it kind of, I think, shifts focus a little bit from what I think is really the core of what's important, which is relationship education, right? How do you relate to yourself as a human being? How do you relate to somebody else as a human being? How do you take care of yourself? You know, how do you think about yourself as a person with a gender, as a person with a sexual orientation or not, or whatever it is? And then how do you see other people? How do you receive other people when they share their stories of their experiences with you? And then if you're trying to create connection, I mean, I think that again, at its core, really like what sex ed could be is this space in which young people get to explore these questions of what does it mean to be a human being. And you know, the reason I think that this plays out or could play out in a sex ed way is that it's been so stigmatized and taboo. It's something in all the places in culture where we don't talk about things because there's taboo. That's actually where violence thrives, right? That's where the sort of that's where the sort of I have someone on a moped driving by. So that's where the basis sort of behaviors show up because there isn't the care there. There isn't the sort of light on how do we actually take care of ourselves, right? If there's no space in society to talk about what it means to want to date as a young person, or want to have sex in a certain way, or want to date a certain gender of a person, then young people are left without information and with urges that are human urges that everybody, you know, has, or most people have. Asexual people too often have romantic urges, you know, whatever the case may be. And so, yeah, I think that it's just important for us to start to understand as a culture, as like in a grassroots way, what we mean by sex ed, what actually is meant by that, rather than just sort of the assumption about what we see in the movies, right? Like if you have sex, you're gonna get an STD and you're gonna die, right? Like that's the sort of the caricature of it. And so that's all the more reason why I think the Healthy Youth Act is so great, is that it really says, it's written in there, you know, like consent education has to be a piece of it, has to be there. And in my opinion, should be the through line actually with any sex education. So when you're talking to legislators, really remember that you're not just talking about sex ed in terms of the nuts and bolts and the biology, you're talking about whole, you know, person health and wellness in terms of wellness internally with oneself, and also then, you know, as people relate to others in whatever ways they choose to. Yeah.
Absolutely. You got a lot of heads shaking, nodding in agreement there, Sukriti. We have another question specific to the Roe Act. Wondering, would any medical doctor be able to give the consent? Or would it be specifically trained doctors? And would it be the same doctor who is providing the termination?
Right.
Lastly, and would this
Those
impact
questions, yeah.
any change in the mass health coverage?
Right. No, that's great. Those are all great questions. I don't want to tell you that I know the answers to all of them. My understanding is that there would be, just like right now, there are certain trained, there are judges that we have people who are interfacing with that and help people to find the judges. It would be similar. There'd be a group of trained professionals. I don't know the answer about the insurance, but I'll take it back to my team to make sure. My assumption is they've already addressed that issue because we work with a lot of healthcare providers in doing this. I think the biggest thing that is kind of a change, and my staff doesn't necessarily like this, but I like it, is that doctors are mandatory reporters. So if they do see signs of violence in a minor, especially, they're required to report it to the state. They're mandatory reporters. Judges are not mandatory reporters. You'll notice there's a pattern. Judges don't make rules that apply to themselves. It's just like how the law works. And the vast majority of judges, it's a very quick, they just generally approve the judicial bypass stuff, and it goes by very quickly. And other people on this call may have more experience, direct personal experience with it. But I don't think that it's necessarily providing the big, huge check that the people who wrote the judicial bypass law thought it would. And arguably, they're not trained to see if somebody's been a victim of abuse. They don't have the medical training to do that. And they're not mandatory reporters. So I don't know specifically which doctors they would go to, and I don't know whether they say they have to be different from the abortion care provider. Those are great questions, which I'll look into. But I will just say that I think that a doctor is almost always in a better position to address the range of circumstances that affect a minor, a youth who is facing an unwanted pregnancy than a judge is. Some great friends of mine are judges. They're not trained to do it. They're like the wrong people. Well, I think it was well-intentioned. I just think they're the wrong people.
I would say so. So we're about to the end of our time. I'll open it up for any last questions for anyone that didn't utilize the chat box. And we encourage, so many great points made here tonight. I'm going to have interdependence like ringing through my head and through my dreams tonight when we think about how we move forward. I do see that that is the opportunity we have ahead of us that might be able to push these two important pieces of legislation forward with all of our collective action. I really thank Carol and Sukriti for taking time to speak with us and share their knowledge and their in-depth work on these topics. And I will hand it over to, who wants to talk? Tony?
Hi, everybody. I just want to add my thanks. I think that many of you might join us now in starting a Sukriti and Carol fan club, maybe separately together, but really you two have just been stellar. Thank you for taking the time. We know how demanding your schedules are generally, and with everything else that's going on right now, we appreciate your commitment to being part of this ongoing conversation. The work, I put in the chat box some links to the fact sheets about the Roe Act and the Healthy Youth Act, along with Take Action. You can find that on the janedoe.org website as well on our policy action page. Just want to underscore that, the legislators, they expect to hear from us. They expect to hear from Carol and her team at the ACLU, right? We know who they really need to be hearing from are all of you. And I know many of your faces on here, but some I don't. It makes all the difference for you to just take 2 minutes when you get off this call right now, just to drop a note to your legislator and say, thank you so, for being a supporter. You can let them know I was just on this call. I'm actually looking for the list that tells you how to find your legislators. And I'm going to put that in the chat box right now. I forgot to do one thing. So please, as a follow-up to this call, if we knew that all 39 of you on this call were going to send a 3-minute, take 3 minutes, click on Find My Legislator, find your state rep, find your state senator, and just say, I just participated in this call hosted by Jane Doe, and I can't believe that it's taking this long to pass these two vital pieces of legislation, the Healthy Youth Act and the Roe Act. And really urge you to follow their lead in terms of moving this legislation forward. It will mean the world to me. And if you want to, you can include that personal story, because that is what will make the difference. But if you don't have the time, you can just say, because this is important to me and people I love, and I care because of the impact it has on people who are victims and experiencing sexual and domestic violence. That would be phenomenal. So that's the first thing I'd ask everybody to do after leaving tonight. The second is, some of you are already on our listserv, and so you receive our notices and updates. You might be following us on social media. As Deborah mentioned, we have an active Facebook page, Instagram page, LinkedIn page, Twitter page. So whatever your poison is, enjoyment is, you can go find us on social media and engage and help us amplify these conversations. Because that's what we need to do, not just be talking to ourselves, but we need to be talking to other people who are not engaged in these conversations. So you can also just forward a newsletter on to a friend saying, hey, I don't know if you are familiar with this organization or have gotten involved, but I thought you might be interested in these topics and in these issues. So you can help us reach other people who aren't those activists, who aren't engaged, and help get the word out. And the third thing I'd say is that tonight's program is hosted by our Grand Circle of Giving, as well as our Young Philanthropists. I see a few of both groups on here tonight, from some of our board members, some of our activists in the community, so thank you for that. Those individuals have made a commitment to make a donation every month, and they give at the level that they're comfortable with. It might be $5 a month, it might be $10 a month, it might be $50 a month. I should say that our Young Philanthropists, pointing to you, Jessica and Alyssa, started this effort almost 2 years ago. And they showed us that this group of 10 people under 40 committed to giving $50 a month. That's $600 a year. They did that for 2 years. They raised over $12,000 for Jane Doe. That is just unbelievable, right? And so finally they looked at us and said, so what are the rest of you doing? So we're like, right. So we created the Grand Circle of Giving as an opportunity for people of all ages to give a donation. Doesn't matter what you give. I just want you to know that we will steward those resources wisely, to put it to work for people who are experiencing sexual and domestic violence, to advocate with our partners on things like the Healthy Youth Act, like immigration reform, like pause surveillance, you name it. We're really trying to be there with a voice that brings the perspective and needs of people experiencing violence, but also looking at the broader issues of racial justice and equity. So thank you for that. We couldn't do that work. We couldn't have the staff doing what we're doing without your financial support. So on behalf of Jane Doe, thank you for those who give. I invite the rest of you to also think about giving. I'm going to stick these last few links right here and say that our last, we hold these gatherings about, I don't know, I guess it's once a quarter. They tend to be in the same sort of time period after work. Don't know yet what the next topic will be, but we hope you'll come back and join us then. We do have one other opportunity to gather. On May 19th, we'll be having our first ever virtual Spring into Action breakfast benefit. So you can come in your PJs, we don't care. You can have a mimosa because we're not serving, but you can just be there with us in the morning from 8 to 9, where we're going to be honoring the partnership behind a really creative and effective teen prevention campaign called Respectfully. And that partnership is the Lieutenant Governor, Karen Polito, who was the brains and said, we need to do this, and mobilized all the resources to make this happen. More advertising, this phenomenal community-based advertising firm who's done a lot of work in the public health arena took this on, and Bank of America really stood up and to be a partner and help make sure we get that message out more broadly to people, to teens and to adults. So we are just delighted that we get to honor them, and you're the first to hear it. Callie Crossley from WGBH Under the Radar, who was our honoree last year, has agreed to moderate the discussion that morning with our honorees. So it'll be a fun morning. It's not going to be your typical give an award, hear an award, speech. We're going to try to keep it a little bit more energetic as a virtual event. So we're delighted that Callie can join us. It's going to be a lot of fun. You can go to our website, find out about it, sign up, plan to join us. We couldn't do this work without your support. So I just want to say thank you again. Thank you to Sara. Thank you to Sukriti. Thank you to Carol. Thank you to all of you, and to the board members who are on here, our supporters, and many of our Jane Doe member programs. And I have to say, there's one person here from Wisconsin, so thank you for joining us. There might be people from elsewhere in the United States. It's really great to be in community here together. And with that, I think we shall call it a wrap and say thank you so, so much, everybody. Let's keep it up. Stay in touch. Namaste to our yoga instructor / sex education instructor. We appreciate it all. Be well. Be in touch, everybody.
Good evening, folks. Thank you.
Thanks all.
Thanks so much.